Hello, I am Dr. Sathwik Shetty. I am a consultant neurosurgeon at Manipal Hospital, Old Airport Road, Bangalore. Today we'll talk about pituitary tumors. Pituitary tumors are tumors which arise from the pituitary gland, which is located at the base of the brain. So pituitary gland is a gland which produces a lot of hormones. Like the growth hormone, the thyroid stimulating hormone, prolactin, sex hormones, and various hormones. Based on from where the tumor arises, is it from the hormone secreting cells or the supporting cells? The pituitary tumors can be either a functioning pituitary adenoma or a non-functioning pituitary adenoma. Most of these patients with pituitary tumors present with the visual disturbances. They have, as the tumor grows, it compresses the optic apparatus, which lies directly above the pituitary gland. And because of the compression of the optic apparatus, the patients generally have blurring of vision. They have a constriction of visual field, that is, they're not able to see the periphery of the fields. And in case the tumors are arising from cells which produce hormones, they can present with either excess production of hormones, or if they're coming from cells which are supporting cells, they sometimes can present with the deficiency of certain hormones as well. And those symptoms can manifest in these patients. So whenever a patient comes with a pituitary gland tumor, one thing to remember is most of these pituitary gland tumors are benign tumors. They are not malignant tumors. And after a good and safe excision, most of these patients go on to lead a normal life. Some of them would require some hormone supplements, but most of them, if it's a non-functioning pituitary adenoma, go on to lead a normal life without any further problems. So the standard of care for these patients now is an surgical excision, wherein we use an endoscope and we plan an endoscopic endonasal approach through the nose and reach the skull base and excise these tumors safely. Previously, such tumors were operated transcranially, but now endoscopic endonasal approach has become the standard of care for surgically excising these tumors. So what we do is we pass an endoscope, we reach the base of the skull, we make an opening in the bone there, which is overlying the pituitary gland. And once we see the tumor, we remove the tumor away from the optic apparatus and debulk these tumors and excise them completely. And in order to help us excise these lesions safely, we use neuronavigation systems and also intraoperative Doppler ultrasound to help us locate the major arteries which are abutting these lesions, and so that we can remove these lesions completely and safely. Post-surgery, patients would require regular follow-up with the neurosurgeon, endocrinologist, and ophthalmologist, and most of these patients do really well in the long term.